Medical emergencies can happen anywhere and at any time. A couple years ago, I was in Fargo with my family at a restaurant. A man had a stroke, and because of common people knowing how to respond during this emergency, they were able to save him until paramedics arrived. I've been trained in CPR and first aid since then, and I know how important it is for people to be responsive during these emergencies. Knowing how to respond in a medical emergency can help save the life of a loved one or even a stranger. There are many common signs of a medical emergency that you can see to make sure that you respond quickly once that person has it. Common signs include change in behavior or action. If a person is walking down the street and they suddenly slow down or they sit to make sure that their posture is better, it's a sign that they might have a medical emergency soon. Another change is breathing. If they're breathing normally and they change to very slow or labored breathing, that could be another sign. Other signs include fainting, vomiting, or profusely bleeding. There are other signs for many common medical emergencies. In heart attack victims, there's major chest pain, along with discomfort in the upper body. They may complain of headaches or shoulder pain or just chest pain overall. In stroke victims, they have weakness in the limbs where their arms and legs might not work as well as they used to, drooping in the face where one half of the face will be drooping, and slurred speech. In cardiac arrest victims, they will be unresponsive and ragged or abnormal breathing. The first step in responding to a medical emergency is to assess the situation. Look around you, see if the person has fallen down on their back or their side, and make sure that you can lay them on a flat surface to respond well to this emergency. The second one is to learn your ABCs. A stands for airway. Make sure that their head is tilted up so that their airway is open and clean so that once they start breathing, they can breathe normally. B is for breathing. Make sure that they're breathing well, and if they aren't breathing, you can use rescue breaths later on. And C is for circulation. Make sure that they aren't in a weird position where their blood wouldn't be able to circulate throughout their body. And check for other injuries. If they have any broken bones or if they're bleeding profusely through other ways, that can change how you respond to this medical emergency. Thirdly is to call 911. Make sure that you delegate someone else so that you can stay with the person in case they change. And fourth is to start rescue breathing or CPR. Many people don't know whether they should do CPR or rescue breathing. With CPR, you do that when there's no breathing or there's no pulse. This can happen when someone suddenly faints or becomes unconscious. When you should do rescue breathing is when a person has a pulse, but they have abnormal or no breathing. The recovery position is something that you can do when someone is unresponsive, but they are breathing. You lay someone on their side, have their arm out and their palm facing upwards, their hand on their cheeks so that their head doesn't hit the surface of the floor, and you have one leg tilted upwards toward their body so that circulation is moving. And make sure that the airway is up and tilted so that they can breathe normally. Mayo Clinic suggests a 30-2 ratio for CPR. The 30 is chest compressions. 30 chest compressions for 2 rescue breaths. If you want to think of that, that's 100 chest compressions per minute. A lot of ways that people use it is to the tune of Staying Alive by the Bee Gees. That's a good way that people can pump to. After the 30 chest compressions, you can move on to the rescue breaths. The American Red Cross suggests that if you aren't trained in CPR, you shouldn't be able to do the rescue breaths, but studies have shown that compression only and compression plus rescue breaths have about the same survival rate. If you have someone there that is trained in rescue breaths, they can tilt the head up, pinch the nose, and breathe in 2 large rescue breaths to help the person breathe normally. For the chest compressions, you should have one hand in the middle of the chest and have your other hand facing over it and interlock your fingers. You can lock your elbows and push down about 2 inches for adults and children. For infants, it's 2 fingers and 1.5 inches deep. And when you stop CPR is whenever the paramedics and EMTs arrive. In conclusion, it's important to know the signs of a medical emergency and how to respond quickly by delegating tasks to people such as calling 911 and assisting in CPR, and knowing how to perform CPR so that you can know when to step in if someone's getting tired from CPR. Responding quickly will help save the lives of anyone in a medical emergency.